Now let's move on to the next segment, which will delve into the subject of healthcare investments. We have Dr. Mohamed Hafez, CEO and founder, TAAFY International Healthcare Co. with us today, who will walk you through everything you need to know about the subject matter, about healthcare investments. I request you all to put your hands together for Dr. Mohamed Hafez.
Good morning, everybody. I have the honor to introduce myself. My name is Dr. Mohamed Hafez, CEO and founder of TAAFY International Healthcare Company. I thank IFAH regarding to this gathering of the elite people. Now we're already talking about presentation about healthcare investment and how the healthcare investment affecting the development in healthcare service itself. Here, just only already doing like small presentation. This is our icon, which already came from TAAFY as an integrated healthcare company related to healthcare service consultancy. We will talk about the service of TAAFY, which in the future, in the next few minutes, we will know why we're already talking about this service. First of all, we are healthcare investment consultant. Here, let us say that there is a doctor and he has a dream to have a project like hospital and he wants his dream to become real. We can support him related to this issue. Okay? What we are already going to do related to healthcare investment, first of all, we have to do valuation for the project itself or the idea, maybe become idea. Second one, it will be feasibility study to know if this project will be visible or not. Third one, fund solution for this guy, because he already need money to do his project and his dream. Then, second one, we're already working as project management and consultant management. Third one, we are already working as a healthcare management and operation. These three services are related to healthcare management and operation related to recruitment, training, quality, HIS, marketing, and development, and sustainability. Okay? These three services we're already working in, which is already making the whole shape of healthcare investment process. Other one, which is treatment abroad, we have the honor to be the sole agent of Premier Healthcare Germany. We're already working in Europe mainly, plus insurance consultancy and innovation. We're already doing a good project with innovation with an Italian company related to automated, semi-automated pharmacy, which name it is Modular. So let us take now about the healthcare investment. Healthcare investment, it has two parties. First party, which is investee. The guy already has a starting, like say, idea, something like this. And investor, this investor already gives the money to the investee to do good relation regarding to the healthcare investment. Related to project, they already will do cooperation between each other to do a project. Maybe this project, small idea, maybe it is like medical machine, maybe it will be like small clinic for dental, maybe it will be big hospital, maybe it will be big medical city. It's okay? So now we are talking about the healthcare investment type. Actually, we have a lot of investment type, but we'll concentrate about two type of healthcare investment. First one, we name it as green, which it is just only start. Yeah, not existing, but it is like idea, I have a land and want to be a hospital, something like this. And the other one, which is named brown, which it is existing. Like to say, there is a hospital and this hospital is not working well and I need fundraising to start to do development regarding this one. What is the area of healthcare investment? Most of the people suggest that regarding to the healthcare investment, we are already talking about hospital only, which it is not true. We are already talking about the healthcare investment, let us say, related to information technology itself, pharmacies, private clinic, dental clinics, medical center, X-ray center, survey center, analysis center, hospitals, medical cities, as we mentioned, medicine factory or pharmaceutical factory, accessory factories, medical devices factory, research center, spas, psychological sanitarium, or medical education or medical university, and medical insurance, and others. Now we're already talking about the healthcare investment. When we're talking about the healthcare investment, it comes to our minds that the doctor will try to steal the money of the patients, okay? Which it is not true. Here, the healthcare investment, not meaning that I will increase the price of the service to get profit, or I have to breach our ethics regarding to the profit. But what is the mean of healthcare investment correctly? The correct definition of healthcare investment is best utilization of available resources. Let's say I have a good doctor, okay, and has experience, very good experience. So I have to utilize him for the maximum regarding to his skills related to the curement of the patient in the right time and with high quality. These three items will lead to customer satisfaction. Customer satisfaction will lead also to optimum investment. Okay. So now the patient satisfaction factor. First one, I suppose that I'm a patient and I need to be satisfied from the service of the hospital. Okay? So first of all, I have to know that this physician or this doctor, he is an expert and professional doctor. I have to know well that this doctor, he can treat me well. It's okay? This first thing. Second items, which are affordable price. Yes, I can go to a good doctor, which has very high fees, so I cannot afford this amount. So if the price is affordable, yes, I can visit this doctor and continue with him. Second one, friendly staff. We always facing a problem related to the communication with nurses or technician and the admin. So if we already have a friendly staff, at this moment, I will be satisfied from the service of the hospital. Clean and modern facilities. It's okay if you're already going for a clean and modern facility, sure. At this time, I feel the trust with the service itself. Benchmarking recovery period. Let's say I already went for Dr. X and Dr. X already gave me treatment and already get cured after 1 month. The other doctor went to another doctor and this doctor already gave me treatment and already get recovery after 1 week. This period is very important for each one of us. Let's say I can do some business, some work, some jobs related to this period. So by this way, I already get saving time and saving money. If these factors already provided for the patient, so at this moment, for the doctor and the hospital, it will get good reputation. Okay? This reputation will lead to increase the flow of the patient to the hospital. And then for the investor himself, if already gets the increasing in the flow, sure, he will get increase in the income. These factors and this service will lead to optimal investments. Okay? Then, now we're already talking about the investment. Each one, like investor, he's waiting to get an opportunity. He's waiting, but it's not good. What is the best and optimal investment? It is creating and not waiting. What does it mean? If already I'm going to create an opportunity for myself or by another people or by another team, so this meaning that I already saving time and also saving money, and I will get a unique or distinguished project. Okay? So now we are talking about create, which is meaning an idea. So if we already get a good idea, so I have to study it well and then started to do modification and development for this area, for this idea, sorry. And then at the end, we are already talking about investment or investing in idea. One of the most important idea, let us take about Da Vinci. Da Vinci machine, it is a robotic surgery machine, which already did what the cannot human being do it in the surgery, like in the small area, and already released the human defect. So we consider Da Vinci one of the most of investment idea. Now we're already talking about fund resourcing. Yes, this investee now need to collecting money to start his project. So what is the sources for fundraising? We have three sources for fundraising. Let's say bank. We have two types of the bank, regular bank or Islamic bank. Second one, non-banking institute like investment company. Okay. Third one, individual. Some individual has the money and want to invest it. So here, why you already choose healthcare investment as our focus of specialty? First one, medical investment has a lot of variety, as we mentioned, like pharmaceutical factory, like hospital, small clinic, and what else? Healthcare investment is long-term investment, not short-term investment. So it is taking a long time, let's do 25, 50. Sometimes some hospital in Germany exceed 150 or 200 years. Then, health doesn't affect with any circumstances. If anyone gets sick, he has to get treatment. So it is continuous business. Else, the highest profit ratio. Okay, healthcare, which is one of the most highest profit ratio related to the other business, and human investment, already working in human investment, and also plus it is a humanitarian professionalism. We're already talking about the healthcare investment in many shapes, but now we're already talking about, as an example, related to Egypt. Okay, Egypt now has a population growth rate very high, so this population, this is our target. Secondly, majority of this population are in the middle class also, which is our target. The Egyptian culture has the treatment and education is the priority. Fourth one, Egyptian people prefer private sector than the public sector. This is related to the demographic reasons. Then, regarding to the governmental healthcare service, it is weak in Egypt. Hospital bed related to the people itself, they have a hospital bed 1.6 per each 1,000 people, but the standard is 2.7. This means there is a lack of the service or the bed available in Egypt by, let us say, about 40%, which it is good opportunity for any business. And low quality system. It's okay? So, now there is also another issue which already making this opportunity, it will be good for us, is that new investment law already appeared in Egypt, which already encourage most of the investors to start to invest in Egypt, not in healthcare only, but in all sectors, but already get a very good privilege for any investor to do healthcare investment in Egypt. Also, already a new insurance and obligatory insurance law already issued in last year. Third one, the starting of the private healthcare insurance to appear in Egypt. Before, the private healthcare insurance is very, very weak. And as we know, that the insurance already is one of the major resources regarding to healthcare service and healthcare income. And Egypt has infrastructure of good quality of the doctor. And then regarding to the stability of the currency rate, making most of the investors start to doing investment in Egypt. ROI, especially in Egypt, regarding to hospital exactly, it is from 35% up to 40%, okay, from the total assets, not from the operation income. We will take a small preview about this one. Let us say that the population in 1998, it was around 65 millions. In 2030, it will become around 90 millions. This meaning that there is increase around 20% in the population within just only 20 years. This meaning that this business, it will not stop. This meaning it is running. Second one, related to the governmental sector. Governmental sector, at 2001, it has 120,000 beds. At 2012, it decreased to be 96. For the private sector, it was at 2001, it was 22,000. At 2012, it became 31,000, which is meaning increased in the private sector. Here, also regarding to the expenditure of the people related to their income, in 2010, it was 8.1. In 2013, it became like 9.8, which increasing 15% just only in 2 years, which it is high indicator that this business is running well. And also, regarding to how much the person already paid by year, it's 2010, it was 100, then 102, 103, 115, which it means it is increased 15% also in just only 3 years. Here, now we're already talking about what is the current situation regarding to healthcare investment in Egypt. I'm sorry, because related to this, it is cut from the newspaper, but here it is to talk about Saudi German Hospital already investing in Egypt around 500 million dollar. Regarding to MENA Health Partners, already invested around $170,000. ILAJ already get acquisition for Alex Hospital and Benzina Hospital. Now ILAJ has acquisition with 13,000 hospitals. 13 hospital in Egypt. Then we're already talking about the vision of 2030 for Egypt related to the health care. We're already talking about the disadvantage or the challenges already related to the health care in Egypt. So for the vision of 2030, this disadvantage or challenges already started to be removed. Let us say was as a one. Here, the statement said, the state said, all Egyptians enjoy a health and safety and safe health life through application. Okay? An integrated healthcare system characterized by availability, quality, and non-discrimination. It is able to improve the health indicator by achieve health coverage and comprehensive prevention, early intervention, achieve the satisfaction of the patient, and for the Egypt to be a pioneer in the field of healthcare service and leading to medical tourism. These are challenges and how already got the solution for it. First one, we mentioned already there is a weak health insurance system. Now the new health insurance obligatory system already released. Second one, absence of healthcare referral system. Now there is a quality system. Inadequate fund available related to the government to cover service. Now start to going for privatization. Lack of coordination between the provider and the buyer. Now there is management and accounting system controlling the payment. Weak MIS infrastructure. Now there is, let us say, there is very big development related to information technology. Weak quality system. Egyptian quality standard related to healthcare system already issued. Poor availability of supplies of equipment. now we already encourage the people to start to establish factory related to supplies and equipment, higher education related to the manpower, not matched with the health field to suit the labor needs, marketing in the healthcare. Now there is private medical education. So now the pillar of investment success, good study and good preparation, which will lead to management, and then for project continuous policy. Hospital model related to TAAFY, how we're already working related to the healthcare investment. We will consider that there is one investee and he has a land and want to do hospital in this land, okay? So first of all, we have to study the land itself, and then doing valuation for this land is an example, and then doing the feasibility study, and then start to release the teaser for private equity or acquisition, and then negotiation between two parties to making this cooperation is viable, and then going for doing the design, construction, and reconstruction according to the case itself, construction and interior. In the same time, we're already doing the policy and the procedure to save times, okay? And then we start to do preparation for the medical equipment, and also in the same time, we're already doing the recruitment. So everything here is parallel. It's okay, not continue, not step by step. We already care about time. And then start to do operation. After 2 years, we already propose this project in the joint stock, and then start to doing recycle again for this business. This is one of our project. I just only give you very small sample about it as a story. This building, this big, very big building, and the owner of this building already requested from us to do a hospital for it. And already when we started to discuss about this one and study the project, we found that the size of the building is very big to do just only hospital in it. So what we're already thinking to divide the building for 3 parts. The first third, which already about 4 floors, it will be in the top, which will be as a hotel. And then the rest will divide it vertically to 2 parts. First part is a hospital, and second part it will be a medical mall, which it will be the first medical mall in Egypt. So by this way, we already started to do 3 projects in this building, also to making a mix between the service. And all these 3 projects are related to the health care. Why? For the hotel itself, we already started to establish as a healthy hotel. What meaning by healthy hotel? We already provide all the healthy product inside it. Let us say cotton linen, something like curtain antibacterial, and natural food, natural items. So now this hotel will be healthy hotel. Second one, hospital. It's okay, it will be like international hospital, and also it will be operated through one of the biggest chains in the world. And third one, it's a medical mall. Medical mall meaning that we have some clinic inside, and we have pharmacy, we have like spa, we have like even government shop, but this government shop also provide these healthy and natural items. And also let us say coffee shop. With coffee shop, it's also provide like healthy drinks. To just only we need to, this building is a healthy and related to the health care. Why already did this mix? Regarding to the hospital itself already, we already thinking to be as attractive point for the people for medical tourism, to start to bring the people from outside to get treatment here. And this will be leads by one of the big chain of the German hospital. It will operate this project. So instead of the people need to get treatment in Germany, he can get treatment in Egypt with the least price, but by the same quality. This is the first. Second, the hotel for companion. okay? And also for the patient himself, if already he finished his treatment inside, as an inpatient inside the hospital, he can spend around 2 or 3 days in this hotel. And third one, for the mall itself, for the mall now already have a pronoun name related to the hospital from the operator, and also have this healthy hotel. So this mall, it will be like icon related to the healthy products, okay? So by this way, related to the mall, we can sell the unit inside it and collecting money. Then this collecting money, we can already furnish the hotel from this money. And related to the hospital, we can find investor for this one. So now, this project, we already consider one of the most elegant project, and already did a good idea and a good innovation related to the idea itself. And the profit of this one, ROI, the ROI of this project, it exceeds 42% from the total investment. Thank you for your attention. And if there is any question, I'm ready and be happy to hear from you.
Thank you very much, Dr. Mohamed. Very attractive idea. My question is, what kind of risks that you have considered in having the three models together, the hospital, the mall, and the hotel together? Let's say in case of emergencies like a novel virus outbreak, or infection, or a disaster, God forbid. What things in place that you have considered just to mitigate this kind of risk?
Yes. Thank you for this good question. Regarding to the main concept of this one, now we already care about two items. First of all, the patient, and to get good treatment, and the right treatment, as we already mentioned, related to this operation hospital by one of the biggest chain in Germany. So now we already provide the treatment itself and caring of the patient. Second one, we already caring about the two parties of the investment process, the investor and the investee. So now already caring about for the investee to get more profit and the investor to get more profit. Let us return it back again related to the infection itself, as you already mentioned. For infection itself, as we already mentioned, related to the operation of the hospital by one of the biggest German chain, it will be sure, it will be going to do controlling for the infections control regarding to this one. And also, we can separate the three parties from each other by some insulation, by some antibacterial or something like this.
My consideration here is that if one, God forbid, is closed, the others will be affected. Like if, God forbid, because I have been through the, 3 novel viruses outbreaks, and I have been just in the middle of that.
I'm sorry, I cannot hear you well. I'm sorry, doctor.
Yeah.
I'm so sorry, but I cannot hear you well because I think the mic is not...
Does everybody hear me?
Yeah, now
okay.
it's good.
All right.
Yeah, now it's okay.
I have been through different novel viruses outbreaks, like, SARS, like Rift Valley, like MERS-CoV. And I know how people are affected, psychologically even. So God forbid, like if a novel virus or like any emergency that is novel to people happens in the hospital, then the other two parts, the mall and the hotel, will be affected. Yeah. So I think it's, I'm just trying to understand how did you calculate the risk. The other thing is that you have like casual people, normal people coming to the mall or to the hotel, right? And I guess probably that the water system, the air conditioning system has to be considered in this case. Those normal people, like, some of them, might have like, asymptomatic period of serious infection.
Yeah.
And then if the water is the same, if the AC is the same, if the people use the same linen in the hospital and the hotel and they're just thinking that they are cleaning them aseptically, still the risk of infection, the risk of is there, plus other natural disasters like fire or whatever. So, I mean, to put these three like important investments or idea in one place, you risk losing all of them at one time. So how do you think about like mitigating such risks?
I consider your question now. Okay, thank you, doctor. Later to say, we can consider these three, yeah, it is in the same building. It's okay. But we can consider these three, this building, it is divided for three buildings. So let us say for sewage and water supply. We already put in the design as it is a separate network for sewage and water supply for each part. So by this way, and also regarding to our engineering, already separate each network with some specification related to their works, okay? So related to this one, we already separate sewage and water supply for each one as its project, as it is single project. This first, related to the water supply and also for electricity. It will also be the same. We consider this, each part in this building, it is considered one entity. This second one. For related to the infection itself, okay? Infection itself, we already also keeping like an insulation between the three buildings because it will not go from one entrance only. The three building, each project in it has its main three entrance, okay? So we can consider that each project has a specific entity. For related to the fire also by the same way, also we consider it is a separate entity and already doing the fire system and fire alarm and firefighting for each project, it is as a separate project. So by this way, already consider that each project from these three inside the same building is considered as separate building. Related to the emergency, related to the hospital, maybe it is not appear in the picture that related to the hospital, we have, as we mentioned, three entrances. One entrance from the back related to the emergency. It's okay? So it has a separate entrance related to the emergency, which will not affect the hospital, which will not affect the hotel, and also it not affect the mall. This is related to your question.
Last point, that it might help you even to think about your project. We are on this platform talking about innovations and, information technology and advances in technology is just, what about patient privacy? If you are having state-of-the-art technology, using, because some people will come to your hotel or the mall, they might share the same Wi-Fi.
I'm sorry, yeah.
You might share the same Wi-Fi or the internet network. So how would you guard against the information and privacy of the patients? The close vicinity of the hospital, and the hotel and the mall, close to the network of the hospital is risky. So how do you really guard against hacking the network of the hospital and then spreading the information of patients?
Yeah,
thank you.
I already got your point, but as we mentioned before, that we already consider that each department, or let's say hospital and mall and hotel, it is a separate entity. And related to the technology itself, as you know, related to the hospital, we're using HIS system, and for the mall it has system, and the hotel it has its system. But as you're already talking about that, maybe related to the machines in the hotel and related to the machines in the mall itself, maybe it affects the network HIS system inside the hospital. At this moment, our engineering also taking the precaution to doing some insulation or some, let us say, like splitter. Really, I don't know, because as you know, it is very, very specialized work. But actually, already making like separation between any service already introduced or provided inside this building as separate entity. Okay.
Hello. Yeah, I'm Dr. Kapil. It was a really nice presentation, Mr. Mohammed.
Yes.
My question is, you mentioned about the returns ROI is 30 to 40% is higher in Egypt, right? In one slide, you have mentioned about that. That is based on what kind of fundamentals? Like, is there so much deficient in services, or in, say,
I'm
tertiary
sorry,
care?
doctor. Again, I think it's the same problem related to the mic. If you already little bit.
Yeah. Can you hear me now?
Yeah, I hear you.
Yeah. In one slide, you have mentioned about the ROI is 35 to 40% higher in Egypt, right? On the return perspective. How, based on what kind of fundamentals is there a total vacuum in the services delivery, or based on what kind of research you have written that in Egypt as vis-a-vis other countries?
To be sure that I already understand your question, now we're already talking about that the specialty of the hospital, right?
No, you have mentioned about the returns on the investment. In one slide, you have mentioned about the returns on the investment is 35 to 40% higher.
ROI, yes, related to the ROI,
Yeah.
it is 35, from 35
Yeah.
up to 40%.
Yeah, based on what kind of fundamentals? What kind of fundamentals you have given this? I mean, based on, like, there are total deficient services, or I just want to understand that.
It's okay. Now, related to the investment itself, we're using some calculation related to the indication of the project in the future, it's okay, as for the feasibility study. One of them is ROI, we're using IRR, and also with the INR. There is a lot of the equation already use it, it's okay? But the most famous one of it is ROI, okay, return of investment. Return of investment related, sometimes we're already talking about the return of investment for the assets itself. Sometimes we're talking about the ROE, sometimes related to the ROA. So we're already talking about a lot of equation. So related of ROI, as already mentioned, it is around from 35 up to 40% from the total asset investment. So let us to consider that one of the project, the total, the evaluation of the land, it is around valuation of the land plus building, plus machine, like all the investment itself, assets, or we name it as a investment capital, it is 1 million, okay, as an example. So the profit at the end, the net profit at the end, it will be around 350,000, okay? Why it is high like this? It is very high percentage related to the ROI. Yeah,
that was the actually main concern, because in
Yeah.
healthcare industry, in hospital industry,
Yeah.
we benchmark approximately a beta of 25 to 30%, right?
Yeah, you are right. Because in Egypt system is already have some special character. Let us say when we're already dealing with a doctor, we have two types of doctor. Doctor with full time inside the hospital, and as a professor, he already came just only for 2 hours to encounter the patient inside. It's okay. So by this way, is already making, like, let's say, saving related to the salary of the full-time professors. Okay, this is the first. Second, related to the rate. Actually, most of the, I think that if already have doctor working for 4 hours per day, at least he already encounter around 20 patients. So the high rate of the people related as outpatient. Related to the inpatient in Egypt, there is very late related to the intensive care unit. So as you know, intensive care unit is highly expensive, and also operation is highly expensive. So by the end of our calculation and our estimation, we find that the average ROI for the most of the project related to the healthcare as a hospital only, it is from 35 to 40%. And also related to the information released every month, we have a society related to the healthcare investment, and we're discussing at the end of the year related to the net profit for each hospital. We found it is like this. It is the average for most of the hospital is started between 30 and to 45%. No hospital get less than 30% as ROI from the total investment according to the current valuation, not the starting of the investment capital.
Thank you.
Thank you. everybody, and thanks for your attention.